that there are actually over 2.3 million children who are living in really fragile home environments. Those are home environments where there are parents with severe mental health conditions, where there's addiction, where there's domestic violence. About 800,000 children living with domestic violence in the home, and that's something we've seen increase over the lockdown period. So almost 1 in 6 children we're talking about here, there's 12 million kids in the country, actually have very fragile home environments. And that's something which clearly has an impact on every aspect of their lives. About 100,000 children are young carers. Another 100,000 children are living in temporary accommodation or are homeless. And nearly 200,000 children are referred to social services but don't get any help. So these are big groups of children who consistently have, you know, a whole weight of difficulties that are stacked against them. And the question really within all of that, there are also many, many children who are living in poverty, and we've seen that number increase, 4 million children living in poverty. And the question with all of this is, you know, okay, so you've worked out how many of these children are, but what do you then do about this? You know, is it just inevitable? Is it the way it is? Or actually, can you do something about it? And I'm very clear that yes, you can do something about it, which I'm sure West London Action for Children would agree with, but you have to identify those children, work out what's needed, and understand their experience of how they are growing up. And at the heart of all that is, you know, recognizing that kids don't just fall into crisis overnight. It's something which builds over time. So you have to look out for it, and you have to actually do something about it at the earliest opportunity when things are going wrong. And if you look at it from kind of really young children onwards, all the signs are there, the clues are there. And I've seen that, you know, increasingly understanding in this job, the clues are there, but so seldom do people see either those clues or think it's their job to see the clues and lead that response. So, for instance, there's 13% of kids that start school only meeting half of what the development goals are for starting school, only half. And that's much more likely to be kids that are living in disadvantage. And when they start, it's 1 in 5 kids, but when they start school so far behind, so many don't catch up. And those that are starting behind in school are much more likely to be behind at GCSEs. They're more likely to be 18 months behind. Disadvantaged kids are 18 months behind at 16. And when, you know, we've just had the GCSE results, and there's been quite a bit of discussion about 70% rising to 79% of kids that have passed. That still leaves 20% that don't. And it does seem to me that, you know, we have to look at a system that allows 20 or 30% of kids to fail each year after so many years in school. So these kids that start behind often stay behind. They're 5 times more likely to be excluded from school along the way, twice as likely to have a social worker or need a social worker. If kids are excluded from school, they're much more likely to be involved, to be identified and groomed and be involved in gangs. We know there's 10,000 kids who are known to the authorities who are involved in gangs. We know there's many more that aren't. And of course, if you're involved in gangs, then really you're much more likely to have very poor long-term prospects. And often that exclusion from school is that trigger point. So again, if someone's looking for the clues, if someone's willing to intervene, that's the point to help. And if you've got poor mental health, if you've got special educational needs, you're much, much more likely to be in that group. And this is in normal times. This is before lockdown, before COVID hits. So as you might expect, those children that are really more vulnerable beforehand have had a much tougher time during COVID and during lockdown than others. There's been this huge range of experiences that some kids have had during lockdown. You know, many will have had a lovely experience, big houses, parents working at home, gardens, fair bit of sun, not today, but fair bit of sun. Others will have had a really tough time in cramped accommodation, sometimes sofa surfing, not having any outdoor space, and lots going on at home. So there's been some real common factors across all those kids that have been having a tough time. The difficulties in emotional well-being during the time with school, just often a protective factor, suddenly stopping overnight. The fragile home environments, and we've seen domestic violence really soaring, but also increasingly understood that education gap. And kids will now have 5 months being out of school. 1 million children won't have had access to the tech, the laptops, the Wi-Fi to be able to get online. And there's been a real divide between some kids that have been on Zoom school virtually for 5 months, you know, with the same lessons but online, and those that haven't even got online at all. And if you can imagine, it's the disadvantaged kids that have fared worse in that. There's a worry about babies, and one of the amazing things I think is to realise is that during lockdown, since the beginning of lockdown, actually about 300,000 babies have been born. So, you know, babies carrying on coming. And about 10% of those will need extra help. But also teenagers, those kids that, you know, were having a difficult time before, where school wasn't a happy place. But actually, now what does that mean 5 months out? Will they ever be able to find their way back into school? So I've been pressing the case, especially for vulnerable kids during lockdown. I think in many ways governments had to look at vulnerable children because they've been such a risk during this period. I was really pleased that there were places for vulnerable kids in school, and schools stayed open in the first place. Not enough vulnerable kids were in school, in my view. About 18% it peaked at in the middle of June, but nonetheless, people have worked hard to really ensure that there's been contact, and that children that were able to come into school have had that support. But now moving towards September, and I've really felt that actually schools needed to get up and running, that we needed to prioritise that. There is the prospect of that restart for kids. And I think that kids have seen, you know, they've seen their parents go back to work, they've seen parts of the economy open, they've seen pubs open, restaurants open, theme parks even, and now it's their turn. There will be a lot of nervousness about going back to school, I'm sure, from kids, from parents and from teachers. And I think it's really important to reassure and now help everyone feel that this is something which is as safe as possible. But I also think that, you know, we need to start looking at things differently. There's been a big shock over this period for everyone. And actually, it's really shown where bits of the system that were creaking and weren't right in the first place haven't been able to cope or have been even further stretched. It's kind of exposed the weakness in the system. And it's also, I think, exposed the vulnerability that so many children have to live with. So as kids come back into school, I think there'll be a lot of children that need extra support, extra mental health support, extra well-being support, and not just to catch up, but actually to be able to find their place in school and feel settled within that. But also there is an opportunity, I think, now to really identify those kids that are at greater risk and that do need additional help. And that, I think, has to be the goal for the coming period. Government clearly said they have a commitment to levelling up. Well, in my view, you know, you can't level up unless you help these kids have a fair crack at life. And that's what hasn't been there before. They endlessly fall through the gaps in services, in different departments, and fall out of the mainstream far too often. So the opportunities here now, I think, to really help these kids not only get on, but give them a boost to where they could be. And for the last 6 months I'm going to be in this job, that's what I'm going to be all about. But also I think the evidence is there of what happens when we have an emergency and we don't have the support in place for those kids who really need it.
Thank you so much, Anne. That's great. And we have got a few questions coming in, and more would be brilliant. But I've got one to start off with, just picking up from what you said. I was having a conversation with the Director of Children's Services early on in lockdown, and he was saying actually he wasn't worried about the kids they already know about, because although, yes, social workers weren't so much going around to the houses, although some were, they were in contact with them. But he said there's a whole cohort of children out there who they don't know about yet, but all the kind of pressures that will be on their families through this period means that, and that, you know, school is not there, was not there for them, because, you know, they weren't turning up at school on the whole. Those safeguarding roles that schools play so importantly weren't happening. I just wonder whether you think that group of children that you're talking about will have expanded through this period.
I think inevitably it would have done. So you've got the kids who were, well, let's say invisible before lockdown. But then there's the heightened pressure of lockdown in itself. Look, there were 1.5 million people applied for universal credit within the first few weeks. There are kids where there's more domestic violence in the home than there had been. There'll be the kids who've fallen behind at school and need to catch up. So I think inevitably there will be those children who have, because of lockdown, will come out in a worse place than they were before. And what will be really important is that once they're back in school, I think, you know, the Director of Children's Services are very open, saying, look, even after a summer holiday, there's always a spike in terms of demand for help. There's going to be a big demand surge once they're back in school and can be in contact with professionals. But I think then really this has to be a long-term recovery. And I think it's going to take 1 or 2 years to help get those children back to a good place. But that is something which absolutely needs to be in place.
Sorry to interrupt. I was just gonna say, one of the things that you were talking about just before was that sort of the extra support is needed in school. And that's one of the questions that's come in. Obviously very pertinent to what West London Action for Children do is, you know, someone's message to say, do you think counselling will be more important in schools in the aftermath of COVID-19? And do you think it will be prioritised in the light of social distancing and new health and safety recommendations? And I suppose added to that is, you know, is the money there? Who's going to pay for it? Is this a thing that charities like WLAC are going to have to pick up, or?
Yeah, so I've said for a long time that I think there needs to be a counsellor in every school. And I guess that's kind of shortcut, but I mean, there needs to be health teams linked into schools, mental health teams. And kids have always said that actually, you know, they want help in school where it's not stigmatized, it's part of everyday life, they can get to know people. And I was really pleased that actually the NHS accepted some of this, and they have a program in place to extend mental health teams in schools. But even when the program's been delivered, it will only go to a quarter full schools over the next 3 years. So I really want that to be turbocharged. You know, it's a really well evidenced program. It works. Everyone thinks it's a good thing. Well, actually now, if we're going to look at kind of Nightingale scale interventions, having that kind of program in actually every school is what I think is needed at the moment. Now, the money isn't there, but there's a spending review in government coming up. So the opportunity to get the money there is shortly going to be in place.
And one question from Rachel Green just now. She says, I work in a secondary school that has high levels of disadvantage. We have approximately 70% of students on free school meals. And a lot of our parents work in retail and hospitality and are looking at redundancies. How can we help these students quickly?
So there'll be a lot of children who are living in households where the, you know, financial situation is really unstable. I think at that point, school has, you know, a really important part to play in just that stability in life and being able to kind of be the safe place and understanding what that means and really being in touch with those kids and being able to be there to reassure them. But also, if there are agencies around, I mean, for instance, like this program, actually working with those parents to help them deal with the stresses of poor finances and difficult situations, but also help in employment too. So those can really make a difference. But I think for schools, it's absolutely, it's really important for kids that schools can see when things are going wrong and help support them. But it's going to be tough. It's going to be tough for a lot of kids and families in the situation. Furlough ends soon. And that's been a big support for a lot of families, especially those in hospitality.
And it is going, oh, that rumbling noise is my dog running back from a walk and making lots of noise. Sorry about everyone if you can hear that. And it is going to be so different for children, isn't it? Because, your school is not going to be the kind of place that you've been used to. If you're in one room and, who knows whether they'll be wearing face masks or not. I don't know what you think about that, but.
Well, we've got the face masking rumbling on. I mean, my view is that if it helps reassure kids and teachers and parents, then schools should just do it anyway. And I think there's more and more schools that are saying they're going to do it anyway. But I think it will be different for kids. But I also think there'll be enough that's the same for people, hopefully soon, to get used to. I've seen a few schools, and I've got more this week that I'm getting out to look at. And whilst, you first of all, you have got all the kind of one-way systems and the signs and all the rest of it, actually, you've also got all your friends there. You've got that group of people, and, that the reassurance of it being a slice of normality you've just not had before. So I think what I've loved is hearing the kind of, the joy of kids going back and being with their friends in June and July. And I think that's something which is great to see. But I hope that kids will feel comfortable in where they are in school.
And someone's message say, might it be possible to advise the government to ask ex-teachers to help in teaching one-to-one or small groups of children who are in these vulnerable groups via education departments and councils, the equivalent of what the NHS did get more medical staff successly in the NHS at the beginning. And I know there was talk about that, wasn't there, at the beginning of all this?
Yeah, there was. And I really, I really tried to get that idea going because I just thought there was such potential. There was just, there was just this real will to do things and to help. And also to help kids in school or actually keep in contact with kids. But I do think, and Robert Halfon, the chair of the Select Committee, has talked about this a lot, there is this potential to have a volunteer army of people who have been involved in schools in the past who could come in and work with kids. There's going to be a tutoring scheme, but I think there's so much more that could be done and so many people that actually do want to help. So that's something that I'll carry on, talking about and really encouraging. But I think that, overall, we've had rainbows in the windows with kids. People, I think, have connected with the fact that actually this is a time, a really anxious time for kids. They haven't been the people who've been most at risk in health terms, but actually, it's been a huge shock to kids in terms of what's happened in their lives.
I wonder whether a lot of it is about kind of an attitude, a sort of can do or can't do. I've done a lot of education stories through this, about the fact that vulnerable children weren't turning up originally, but, later about whether schools are reopening and the GCSE and A-level and all of that. And it seemed, I've met a lot of head teachers through this, and it's just really interesting, the sort of different attitudes that people have. And I understand a lot of it is about your staff members and, them being worried and having to reassure them. But just simple things like I was speaking to one and he was saying, well, we're not going to be able to go on any school trips. And I said, why not? He said, well, we can't take public transport. And I said, well, but they're in a bubble. Can't you put them on a coach? And then they were saying about, chemistry. Oh, well, the children won't be doing any experiments in chemistry. The teacher will just be demonstrating. And I said, why? And he said, because it's too dangerous for them to share the equipment. And then I was reading another head teacher in the paper saying, it'll just take a bit longer to do the experiments because we'll have to wipe down the equipment between children. And I was just thinking, surely, it's got to try and be positive.
I mean, you can understand. I mean, I think it is, and me too. When I've met, I've been to some schools and met head teachers where, they've they've had fantastic enthusiasm. They've looked at everything and they've looked at what they can do rather than what they can't do. But I think, you know, it is understandable, and especially at first, there's just this huge responsibility. And they will have said, you know, so many have said to me, look, we've got 90 pages of guidance that come through the door, you know, every few hours. And just following that in itself is just such a, you know, it's such a weight that we have to carry. So I hope that actually once kids get back in and people start to build that confidence, that actually people will see what they can do, and that confidence can build over time. I mean, the first time I went into a shop, that was, you know, the person on the door kind of actually leapt on me and kind of, you know, ushered me around one by one. But so I think over time this kind of builds, but it is something we're going to have to live with. So it is something that we're going to have to learn not only to manage, but also to manage with confidence.
And you've done a lot on the kind of educational attainment gap before all this. And you were just mentioning earlier about tech, and, you know, one of the most egregious things about this seems to me have been the sort of massive divide, particularly obviously between private and state, but not all of that in terms of what's happening. And I remember having a conversation at the time when, you know, the government had said we're going to, you know, provide laptops or whatever, and then that took a really long time to come through for perhaps some understandable reasons. And I was speaking to a head in one of those schools that's affiliated to, so it's a state school but affiliated to a private school, and he said because of the private school money, we had the money, we just bought Chromebooks for every single kid who didn't have one and their siblings, and I went round and delivered it on day one. And you just thought that is obviously it's about money. And we've got a question about tech from someone, which is, are there any nationwide plans to get more tech available to children who've got no current access? Because I guess clearly if there is a second wave and suddenly all the kids are back at home,
that's right,
we go back to the beginning again.
I mean, I heard of schools early on, and they were independent schools, private schools, you know, they just issued teams, which, you know, most office workers have been living on. They issue teams to every child, and they just had them on every morning at 9 o'clock, and they just taught lessons all day long. So, you know, where you've got kids at home in those homes where they were actually on these kind of Zoom schools, they were scurrying off and doing their lessons like everyone else. We haven't yet got the data in on how different that's been for different kids, but some of the surveys that have come through have shown that, you know, 40% of kids have been on for less than 2 hours a day, 95% of disadvantaged kids have not been on, you know, just all of this time where, you know, even in the summer holidays, they say that accounts for the majority of the disadvantage gap. Well, actually, we've just had not 6 weeks, we've had 5 months. So there's going to be a huge divide there. The tech, there was a second batch that has just gone out, I think, or is it just a new phase? But, you know, this stuff needs to get out fast, and it needs to get out to the right people and right people fast. So, yeah, I mean, we know that if we click online and go to Amazon, stuff comes the next day. It's difficult to understand why large-scale public procurement can't be quite as fast.
We've been learning a lot about large-scale public procurement over the last few months. Jane Straker has asked, do you have any particular advice for school governors and the role they can play with the return to school?
Well, clearly, as a governance role, you're going to want to be involved in supporting the head teacher and supporting staff. I would say being on school premises and seeing what's happening and really keeping in touch with how the school's faring, really looking at the communication with parents. I think that's really interesting and really important. So again, you've had some schools that have had, you know, lots and lots of communication with parents. Even to a couple of weeks ago, there's been some people that I know that are saying, well, I haven't heard yet. And I think it's just really important to keep that communication going. So from a governance point of view, yes, of course, you're going to have, you know, your staff team that are going to be looking at operational responsibilities. And it's important to know that everything like there's in place. But really, I think I'd do a plea to think about communication with parents, and also with kids too, because, you know, this is, I think the more that people can know, the more that people can be involved, the more reassured people will get.
And on the whole, we've focused on the sort of downsides of lockdown, the downsides of this period, and potential mental health issues. But someone's emailed quite rightly. I remember reading this recently. It says some recent studies have indicated anxiety levels dropping in many teenagers during lockdown.
For some kids, yeah.
Does that point schools being harmful environments for children's mental health? Or is it the schools or is it the friends? I don't know. But
so,
what do you think about that?
Yeah, so when you ask kids normally what they want, I remember doing this at Christmas time. What would you really want for Christmas? They actually say time to spend with our family. That's the thing that so many kids often say. And that's what they've had during this period, which they would never have had a slice of time like this before. Time with their family being at home. And an extraordinary period, but for some children, a slice of life which is very unusual and which will have been quite precious. And I think actually moving out of that and moving beyond that security back into school in itself will be hard for some kids. They'll have found that quite intimate home environment quite reassuring. And especially children with special educational needs have found school tough, and kids that have been bullied in school, not to have to go there every day, I know has been something that parents report has really helped with anxiety. And it's really important that, schools are able to recognise what they need, and that actually government has got a review going on of special educational needs, and it needs to make sure that the support's in place for school to be a good place for all kids, because it can't be right that some I feel the whole process of going to school is just, such a level of anxiety.
Well, maybe it's also about social media. I don't know. I mean, I was doing an interview on Newsnight the other night about this, and someone was talking about quarantine bragging and how that has been going on, the people putting on their perfect lives. But generally, there's been this sense that it's really stressful being a teenager anyway, and it's particularly stressful seeing your friends going to parties that you're not invited to, or whatever it might be, or going on amazing holidays, and nobody's been able to do any of that. So you haven't got anxiety.
So there has been a bit of a leveling off, as you say. You've not been able to buy any new clothes. Well, not at first. You've not been able to go out. You've been at home like everyone else. There's this sense that actually people have become a little bit more sure in themselves because life went on beyond that. So I think that is something that actually kids will take from that. But I mean, the chaos that lots of other kids have experienced during that time, not least the kids who expected to take exams and then didn't take exams and then have just kind of felt quite in limbo for some time now, is something which again has caused a level of anxiety in itself.
We've got quite a few questions about the youngest children. You were talking about 300,000 babies born since lockdown. And I remember filming about a couple of months ago in a nursery that had come back, and it was interesting because the women there, the staff in the nursery, were saying they'd been so worried. They'd been really prepared for these very traumatized children to come back and not know what to expect and be in tears. And they said it was completely the opposite. These sort of 2, 3 and 4-year-olds arrived so happy to see their friends, running around, just completely resilient and bounced back immediately. We have got some questions about particularly around early years, around Sure Start. Would you advocate reinstating the Sure Start early years scheme, as it did so much to improve the prospects of our children? Someone else said, do you think we should return to the Sure Start model to help with early intervention?
Yeah, so, well, I've always been a bit of a Sure Start fan. I was really involved with Sure Start from the start. I worked on Sure Start. It was actually my first taste of being around government. I got seconded in for a year to help look at that. So whether you call it Sure Start, whether you call it family hubs, because there is now an interest in family hubs or children's centres, whatever it is, the model of actually having somewhere in your community that you can know and trust, people that can help, before crisis hits, where you can go and see your health visitor, where you can go get your child weighed, whatever that is, and have a cup of tea. It's just absolute sense. And we published an early years report month ago, and as part of that we advocated children's centres and family hubs. you could have them in area disadvantage. You can look at where they are, but actually there's still about 2,000 children's centres there to build on. So there is an infrastructure there to build on. They need added resources, but there's so much to be gained if you have something like that in your locality.
I guess the government's never going to call it Sure Start, but
well, that's why I say you call it what you want.
Yeah. Kate Boxer-Misson, can I ask your opinion on preschool children? What impact do you think the lockdown has had on their development in terms of lack of socialization? And I think that every time I saw a child in the street from a distance, you know, when you went for your hour of exercise and you saw, you know, a child who didn't really know what was going on being kept away from everybody because that was how life was. And you just think, what is that doing to them? Are they the group that have actually suffered the most? I mean, I guess that you can't put a hierarchy on it, but it must be strange.
So I think that a lot of parents have said that actually their children of that age got quite withdrawn because they didn't know what was going on. They didn't understand. The sense of time for kids generally, I think, is different. So, you know, a month can be a lifetime, and when you've got little kids, then you don't know what's coming. You don't know why it's happening. You don't know whether life is ever going to be like back in the way it was before. Again, this is just the new normal, literally. I know that's how we all felt at various points, but I think if you're very young, that's the case. So I think that it is a particular difficulty potentially with young kids. I do think, though, generally children can be quite resilient. So actually getting back into environments where they're with their friends and more, I think a lot of younger children did carry on going to their early years provision during that time. And it was great to see that in action because actually, you know, it in itself was really reaffirming. But, you know, early years providers need to be able to get up and running back in September and get as many of those in as need to be there.
And yet a lot of them are in great financial difficulty, as I understand it.
Yeah, they're having a tough time. And you've got a market there, which is very much a market, has lots of private and voluntary sector in there. They have carried on having the kind of funds from government, but actually that's only part of it. A lot were furloughed. And actually, as the furlough scheme comes to an end, that'll be crunch point for a lot of people. And most people don't go into kind of early years provision to make money. They go in because, you know, they love it and they feel a real draw to that and really understand the support that brings to families. But actually, you know, they often don't have huge reserves there that can keep them going. So I've argued that there should be more support for the early years sector to keep them going till they can get the numbers back up.
And what about, I mean, those really stark figures about educational attainment and the sort of north-south divides, but, you know, all sorts of divides. I mean, someone has emailed saying, what support do you think can be given to parents to support their children to achieve? So the north-south divide, I really wanted to do that piece of work because I wanted to show the stark reality. And so much of that, you know, I want kids in Hackney to succeed. But schools in London had such a boost with the London Challenge scheme, which really helped schools. It just put a rocket boost under schools and really meant that those schools just improved in quality so much. And we haven't had that in different parts of the country. So the argument being that, you know, again, this is something that you can do something about. And if you can incentivize, you know, real improvement in schools, real improvement to get some of the best teachers and help those schools develop with support, then you can really change what you can offer children. So yes, absolutely parent support and family support as well as part of it, because I talked about those kids who were coming into school not reaching half of their developmental goals. Well, actually, I think they're the prime group of parents who really could benefit from family support. Again, whether you call it troubled families or not, but you know, we know who those kids are and who those families are and who benefit from support. But then also really help those families in getting kids into school, you know, as far ahead as possible. But then also work with the family in terms of how those kids are supported in school. So you know, sometimes there's this kind of feeling that, you know, you don't talk about families, you just talk about kids, but actually, you know,
we're pretty much a job lot with our families. So actually, there's so much to be gained by working with families overall. And one of the schemes that, you know, again, has had its various kind of endpoints in sight, is the Troubled Families program. And, you know, that's one which will need to be continued, in my view. But really, there could be so much to be gained if that could be expanded, if it could be really targeted towards kids, the group of kids I'm talking about, and really linked into helping kids start school at the best place and actually progress through school.
And the reason why you and I know each other outside of this Zoom is because of work that we were doing on Newsnight and have been continued to do about children in care being put in unregulated accommodation up and down the country. And I just wondered whether you think, you know, what's happened to those kind of children through lockdown. We tried to do a piece about it. There was all sorts of conversations being had that, you know, early on that, you know, staff weren't turning up and children were being left in, you know, unregulated children's homes, but other places too. You know, they haven't really got advocates on their behalf, and in lockdown the social worker was not, you know, there for them in the same way that they would have been before. Do you think, you know, that actually those kids have really lacked support through this period?
So I think those kids have been, of the kids in care, have been some of the most vulnerable, because they were seen to be almost on the outskirts of the care system in itself. And if you think, you know, it's not only the vulnerable kids that have heightened vulnerability during lockdown, but also the parts of the system that were creaking beforehand, and this was one of them, have really been stretched and potentially stretched their limits during lockdown. And part of this, we've talked about it a lot, is the fact that there's so many more now older kids in care than there used to be before. So the care system hasn't been designed for a quarter of all the kids in care to be 16 and 17-year-olds, which it is now. So the kind of care support isn't there to the level needed. And these are children who aren't likely to be, easily matched with foster carers than younger kids. So they are, I think, the ones that will have been, at the margins, or really at risk of being in the margins. I had a conversation this afternoon with organisations, charities that are working with children who were new to the UK, unaccompanied asylum-seeking children, many of whom are disproportionately in unregulated provision. And they said that they felt that despite good intentions, because social workers were working through screens and not being able to go out and find kids and talk to them, often those children hadn't had the contact that they would hope or had before, because they weren't always, their needs weren't always understood. Then they felt that they had again fallen off the radar, and because they were additionally vulnerable, then actually they felt that they were being targeted by individuals who were either trying to exploit them or traffic them and the like, because they actually wanted human contact and were being groomed by these individuals. So I think there's potentially some really worrying experiences that have gone on there, and I guess one of my questions there to that group of charities was, did they think it was now changing as normal practices were starting to resume? And they felt that there were some changes, but there was just a whole group of children that had fallen off the radar in terms of the care responsibilities. So that's one certainly I'm going to be looking at with those charities.
You must come across so many shocking stories in your job.
Yeah.
Are there things that particularly stand out? Is that how you decide where you're going to focus? You know, at times you hear something that just is so horrific, you've got to.
Well, there's an element of that, yeah. So there are things that you hear where you know you have to do something about it, because it is either so horrific, or you can see that actually there is something here which is where the system just doesn't fit, or the system is just not changing or seeing what it needs to do. So for instance, with that, I will now write to all directors of children's services across London, they were largely in London, and ask them to be particularly kind of mindful for these things, and ask them to particularly let me know how they are going to be responding to those kids. But certainly,
does that work? When you do that, does that work? Do you have, I mean, obviously you have clout in the sense that you're a high profile person with this very important role, but there's no statutory duty or anything for them to listen.
No, but I'm pleased to say I do get a reasonably good response. I mean, it doesn't always happen. Not everyone. One of the slight frustrations, you can't make people do what you want, but you know, you have to live with that in all aspects of your life. But we've got a representation service where especially kids in care will get in touch. You know, if they're being moved and they've not been involved and they don't want to move, and you know, it's not in their best interest, I will intervene with that council and ask them to look again. And in the vast majority of cases, they will do that, and that will be positively resolved, which you know is really important. But so much, going back to your question, really, it's really important to listen to what kids are saying. And one of the things really early on was, for the first, I don't know, 6 months or so, so many kids talked to me about mental health support. And just one after the other kept telling me, well, you know, there's no point in asking for help because we won't get it. There just isn't any out there. We won't get it. You know, I'm not ill enough. Some kids actually said, you have to have tried to take your own life before you can get help. And once that number of children have told you that without any asking of the question, then I can use the powers I've got to collect data to, you know, test that out and get the real evidence on what the scale of that is. And that's what's helped build the case for more mental health support. The fact that kids raised it themselves and just said, look, this is one of the things that we're really not only really worried about, but actually, you know, it's hopeless. What's the point? We followed that through with research. We found out how many kids, what percentage of kids were being turned away. And then was able to kind of really push that through in terms of change. And I think clearly there's lots of other things going on, but that helped build that case for a much more coherent priority for mental health support, which is in place now, but needs to deliver faster.
And I've got a couple of questions here. Liz Alvey says, are there any countries that you feel have been particularly successful with their approach to safeguarding children's mental health during the pandemic that we should be looking to? And then a slightly wider question from Janet Hillman, which is, do you have any examples of countries where improving outcomes for children across the board are working effectively?
Well, it's interesting where looking at which countries put children in a much higher priority, which tends to flow. They don't get everything right, but actually there are some countries where kids get a much higher priority in the kind of public debate and in policy terms. I'm thinking, well, Scandinavia is often talked about. Norway is a country where, you know, children's issues are very much at the forefront. Finland, places like that. Now, one thing that was really interesting when lockdown came about, the PM in Norway and Denmark, I think, and New Zealand, straight away did a press conference for kids. You know, the kind of thing we saw at 5 o'clock in the afternoon. They did a number of conferences like that straight for kids. They took questions from children, they addressed children directly, and they talked to them about what was going on, to reassure them, to tell them what it meant, to say that, you know, we understand and we're on their side. And I think that really says something about the country that does that, because, you know, it demonstrates to those kids that they're part of this whole journey, but also part of the solution. I've been trying to get one of those in this country, and the Secretary of State for Education has made a few remarks to children as part of his press briefings, but we've not yet had the PM's full press briefing for kids. But you know, I will be hoping to have one of those at some point.
And maybe right now the Secretary of State's not that popular with that many children, just right now. You mentioned earlier about radical thoughts, and one of the really interesting articles I read early on was about how this period will enable us to learn things in a really short period of time that we wouldn't have been able to learn for years, be that what happens if mainly children don't go to school for 5 months. We don't know the answer yet, actually, probably, but we will know. Or what happens if you shut down airlines and nobody does business travel? Does that mean that business travel doesn't come back because everyone does it on Zoom from now forever? But I just wonder, in your realm, are there really radical things that you think, well, we've learned this now, or we're learning it, that we could do something really, we have got the opportunity to do something really different? So on your wish list, what would that be?
So one of those things which I wouldn't put on my wish list, but one of the things which obviously has been radical, has been that children's learning suddenly went out of the classroom. Suddenly everyone had to learn at home. And I think what we know from those who did it successfully, it can be done. What we also know is that for most kids, it doesn't work. The risks are too high. They just can't sustain that. But the radical things that I think is that really, if you are going to look at how you rebuild confidence in a country, then actually you have to start with kids. And so if you want to lead recovery, start with kids, kind of get your priorities right, if you like. And I think now there is a chance to look and understand better about helping kids early on and not allowing them to get to the stage where they're in crisis. Because we've seen, and it's exposed that level of vulnerability through lockdown. So I think there's been more public support for vulnerable children during this period than I've seen before. I think somehow it enabled people to be able to have a clearer conception of what vulnerability was. They understood it was tough being at home when you couldn't get out. It was difficult if there were issues within the home, if you've got fragile home environment, all of those things. People could understand it better. It wasn't someone else's problem quite as much. And what we've had in lockdown is quite an unusual response, where actually I think people have shown that they cared for people in their community and each other. And the ability to be able to capture that and then kind of enshrine it in actually how we look after each other and look after the vulnerable in normal times is something that I think is still there as a potential. And if you could do that with kids and build it into your approach to helping keep not only kids safe, but actually giving them the boosters they need to get on in life, then it would be remarkable.
And yet we're at a time of immense, economic woes, and Children's Services Department councils up and down the country, there's all sorts of predictions that councils are going to go bankrupt. Someone's message saying, how do we safeguard at this time against increased risk of grooming or county lines recruitment when key professionals have limits on their face-to-face contacts? And I suppose that's the point about money. It's not like children's services budgets are going to go up as a result of this, and social workers are pressed anyway.
So that is the agony of that potential, because the potential's there to do that. And at some point you can almost feel that and the willingness to go with that. But at the same time, everyone knows that the economy is going to be, entering one of the largest recession, if we're not already in there, for a considerable amount of time. So the potential is there, but the economics don't help with that. I mean, I've always argued that actually this is about intervening to help not only save, children's futures, but actually save money as well, because it costs so much if you allow things to go wrong and try to deal with crises afterwards. So there is a kind of logical, common sense approach in that, but it's not how governments are used to kind of, making their sums work. That's not how they're used to. They're used to looking at short-term cycles and used to looking at what was done last year. That has to change. So again, if you want to level up, then you are going to have to start with this group of children, and you're going to have to give them every bit of resilience they can to be able to get ahead in a period of recession. So again, it makes sense to help those kids through. But it's a tougher argument. Sure, when money's there, some of these things can fall into place much easier than if they have to argue their own case against any other priority that any government might have.
And your job is just such an important job, and as an advocate for children, I wonder, you know, does it keep you awake at night?
It's certainly something that it does occasionally. I think you have to feel that responsibility, because you are sometimes that warrior for that child that, you know, you might be the only one. And I guess I felt that most where there's been children who have been in institutions where, you know, they have the weight of the institution and you really to be able to argue their case. But, you know, there's no point in feeling bashful about it, because actually those kids rely on you being able to go out there and make that change and have that impact. So if you're ever feeling weak at any moment, you have to just remember that actually, you know, kids are relying on you, so get on with it.
And you're coming to the end of your term, 6 months or so left. Are there things, you know, what's the thing that surprised you the most, and what are you most proud of?
I'm proud of I'm proud that now people understand how vulnerability really impacts on children's lives much more. I mean, we're not in any way, you know, at the end of the road on that, but I think there's a greater understanding, and vulnerability's been so much more in the spotlight, and I'm really pleased about that. I'm pleased that, you know, there's more mental health support for children, acceptance that that's needed. That's something that I am really proud of. But when the harshest moments are when you go talk to kids when they are in somewhere, like, you know, if they're in custody or prison. And quite early on, I went to talk to girls that were behind closed doors in custody, and there's not many, actually. There's only about 25, 30 at any time. And I talked to those girls, not about, you know, how the prison was treating them, but about how they ended up there. What was it that led to them being there, and what could have been different? And after about the second or third conversation, every conversation was the same. It was almost a blueprint. And at any point, someone could have noticed and changed that, you know, that course of their life, but it didn't happen. And that's something that I think, you know, has to change. We have to build in not only the determination to find those kids, but also the triggers to make that happen. And people say, look, you know, with kids that are excluded from school, and thousands are excluded from school, it's the second exclusion that is the trigger point for them to really get to the point where they're very vulnerable to exploitation and getting involved with the law. Well, actually, wouldn't that be a point to, you know, when the first exclusion happens, wouldn't be that a point to pile in support to stop the second exclusion happening? So it just has to be a much more intelligent system that understands how kids live their lives and how vulnerability impacts and drives not only certain behavior, but also, you know, within the wider family as well.
And I'm sure your fight will continue even after you've finished as Children's Commissioner for England. But that, at 8:30, is the end of this summer series. The whole summer series is now over on behalf of West London Action for Children. If you want to know anything more about their work, you can go onto their website, which is www.wlac.org.uk. Thank you so much, everybody who has supported this series throughout, and of course anybody who's listening today, and of course thank you to you, Anne Longfield. That was just really illuminating.
That's great.
And thank you very much. So goodbye until the next time we meet in a blustery field or somewhere where I come and do an interview with you. Thank you, everybody. Goodbye.
Bye, everyone.